We're here today to share on how to enhance your practice with ASCEplus. We have invited exceptional speakers joining us today who will be sharing their expertise on how they are using ASC in their practices. We have Dr. Rosario Blas, Dr. Almond Bibo, and Mr. Byung-Sung Cho. The lecture will be 15 minutes each, and we will have 5 minutes Q&A right after each presentation. So if you would like to ask any questions to speakers, please press the Q&A button in the below and leave your questions to the speakers today. Without further ado, let us begin with our first speaker, Dr. Rosario Blas, a board-certified dermatologist from Philippines. She is currently a consultant in St. Luke's Medical Center and Center Medical International. Let us welcome Dr. Blas presenting the healing ability of ExoCoBio exosomes.
Hello, good afternoon. Thank you for having me back here in Seoul. It's a pleasure to always be here. So, this one next. It doesn't move. Sorry. Technical. This one or this one? This one. This one. All right. So, slide. Okay. So all of us are intimately familiar with what happens to the skin, hair, and nails over time due to disease or just due to aging. In this slide, done by work from Mayo Clinic, you will see here patients' concerns. And on this side of the slide, you will see what happens from a structural point of view. In essence, what you will see basically here are two things. One is cellular senescence, and the second is that there will be a decrease in the ability of the patient's cells to heal and repair itself. Luckily, in this day and age, we have both cellular and cell-free treatment options to help our patients. For this afternoon, we're going to focus on exosomes. Now, this is again the work from Mayo Clinic. It says here you can see what exosomes are. Basically, it's a lipid bilayer membrane that has specific biomarkers. But what is important now is that in 2023, the International Society of Extracellular Vesicles has updated their missive guidelines. And what they would want us to remember is that we should try to avoid using the word exosomes and instead use small extracellular vesicles. However, the ISAV is a group of over 1,000 experts in 53 different countries that have come up with the guidelines that will help both clinicians, researchers, and governing bodies in this world of extracellular vesicles. But for the purposes of this lecture and for clinical practice, exosomes are what we will normally use, and that is what the public knows. Exosomes are basically not alive, they can't replicate, and exosomes are only as good as its origin, its purification and isolation process. The lipid bilayer membrane is the key here. The lipid bilayer membrane is anti-inflammatory, and this is evolutionarily conserved across all species. Now, what we will see now are some of the medical cases that we've worked with in the Philippines and also aesthetic cases. So this first case is unusual because the patient comes in, a 6-month history of scaly pruritic patches and plaques on the scalp, and was treated by a wide number, several doctors as psoriasis, seborrheic dermatitis, and with no response. This was the picture that his wife sent to me. And so they were both concerned that eventually this would spread all over the scalp and her husband would become bald. So that's why the husband agreed to come to me. Now, hindsight is 2020. So knowing the history of this patient, what we did is I did a biopsy, and here you can see the biopsy, you can see the histopath. It turns out to be actinic keratosis. Now, I used SRLV here, because I did a biopsy, there was a hole. And so what I did, I just poured in some of the SRLV, a few drops, and I sent the patient home with Exobalm. This was on day 12 when I was supposed to remove the sutures, you can see that there's marked improvement. And the patient was very happy, and he had applied the ExoBalm over all the other lesions, and to this very day, there has been no recurrence and his hair grows. Now, this is another case that was brought to me. I was working with Dr. Patricia Gunn for this. This is a very interesting case because the patient had lost her job. She was a teacher, a teacher's assistant, and because of the vitiligo that showed on her palms, she no longer could work. This patient was resistant to treatment. She was not responsive to the usual topical medicines, to phototherapy, and we were waiting for another medicine to come into the Philippines. However, since she was desperate, I decided to try ExoCoBio exosomes for her. So here I used the HRLV because I wanted to repigment. And I knew that HRLV caused darkening of the hair. So simply, I used microneedling down to a depth of 2 millimeters, and I used 36 or 42 pins. I did several passes per area, and you can see here the improvement in 2 of the lesions. And you can also see here that the previously hypopigmented patches are already pink. So the patient is very happy, and this case is a work in progress, and I will update you soon. This is one of my favorite cases. I worked with Dr. Elaine Ko for this. This is a case of exfoliative dermatitis. Again, using SRLV because the skin was already damaged. There was no reason to do any other procedure, merely apply the reconstituted SRLV on this case. And since the patient came because he had symptoms of burning and itching that were uncontrollable for him, the moment Dr. Ko applied the medicine, within the hour, the patient experienced a great relief and he had no recurrence of the symptoms anymore. And as you can see here, 6 months down the line, he is a very happy patient. And here is the reference to show you that ExoCoBio exosomes really work in cases of atopic dermatitis and exfoliative dermatitis because there is an increase in ceramides, and you can see here it decreases IL-4 and also decreases the disruptors. So this is a very interesting case that we have, and we've been using it already extensively. Now we move towards the aesthetic cases. This is a work done with Dr. Agbon, and this one we did fractional CO2 laser and SRLV application. So here you can see he was very red, very erythematous, and SRLV was immediately applied. This is 4 hours later, and this is on day 8. What is significant about using exosomes with energy-based devices, whether fractional or not, it's important to understand that when you do it, number one, the symptoms of erythema, the symptoms of pruritus, the symptoms of stinging pain, all disappear, usually within a few hours to overnight. And at the same time, the duration of recovery is cut in half. So definitely the use of ExoCoBio exosomes will, number one, make your patients feel better immediately after the procedure, and it will also shorten the duration of recovery. This is another patient who had melasma. However, what we do in the Philippines is that we try to look at the health, the overall skin health of the patient. So we don't really look at the melasma per se, but we instead improve the whole skin, definitely. So you can see here that the surrounding skin is clearer, as well as there's a decrease in the pigmentation. Now we move to the hair. Everyone knows that ExoCoBio exosomes are the only ones so far on the market that darken hair. And the reason why hair grows, usually seen within 1 to 2 sessions, is because it affects positively the Wnt and beta-catenin pathway here. This case is very interesting. Normally in the Philippines, we tell the patient, come in For treatment, the second treatment should be done 2 weeks to 1 month apart, and then subsequent treatments are monthly. This patient has had autologous micrografting done. Within 1 year, 7 months, his hair started to fall, and this is it. I told him, please come 2 weeks after the first treatment, but being the busy guy that he is and having his own mind, he decided to come for the second treatment 4 months later, the third treatment 6 months later, the fourth treatment 8 months later. Yet, this is what we see. So I think with ExoCoBio HRLV, the timing of the treatment sessions is not as important as the quality of the exosomes that you are using for your patients. So normally the vertex part is easier to have positive results, but you can see here in the frontotemporal, for this one, I went to a depth of 1.5 to 2 millimeters, but of course the patient was very happy. Now, the question that I get a lot is, what are the unwanted or side reactions? So here I have listed some of the ones that I have seen. However, luckily with HRLV and SRLV, we've never had anything like these. What's important to always understand is that don't inject. As far as regulatory procedures, regulatory requirements are, we can't inject. If you do inject it off-label, just do it in private, in the safety of your own clinic, and make sure the patient understands. I have had one referral during a conference. One of my colleagues said, right there in the Q&A on stage, said that we had a patient that was admitted in the hospital because exosomes were injected. So my first question was, what kind of exosomes were injected? Secondly, what reason? And so they're in the course of establishing what kind of exosomes, because this was done not in a hospital, but in a standalone clinic outside. So it's very important for us to be aware that with the number of patients, the number of cases that we are doing, for sure there will be some unwanted reactions, some delayed responses. However, it's always important. The learning curve is always in knowing what is in the bottle. What is this so-called exosome? And so I put my trust in ExoCoBio exosomes because they have been transparent from day one, showing us how they have processed the exosomes, where their sources are, and they handle it from the beginning to the end. So my take-home messages are two things. Number one, nothing can replace sound medical judgment. We spent all these years in college, in med school, nothing can replace that. It's always important to control, for example, comorbids, if the patient is hypertensive, diabetic, if the patient is a smoker, try to convince them to give up smoking, because for sure, exosomes will work, but there will be a delayed response. And perhaps the most important take-home message for today is this: not all exosomes are alike, just that not all that glitters is gold. And thank you for your time.
Thank you so much, Dr. Glass. It was really insightful lecture. We have a Q&A session.
Sorry.
So,
Sorry.
First question we got,
Yes.
Can we move on to question?
Yeah.
So first question, for your study on melasma case, in your experience, what was the best combination of device that worked best with exosome for melasma cases?
If you're talking about, for me, it's not so much the combination of devices. For me, it's number one, making sure that the patient has no comorbids that we can control. So for example, the case that I presented, the patient had been on steroids because the patient had endometriosis. So making sure the patient is in best health would be very important. One. Secondly, whether it's microneedling or picofractional lasers, anything will work. For me, it's more important that what exosome do you use? So, for example, you're going to use microneedling because the patient can't afford a laser procedure. you would normally microneedle and then you would normally apply some of the exosome, microneedle apply. So when you use microneedling, you would definitely be using several passes, not just one, versus using an energy-based device wherein one pass would be enough.
Thank you for your answer. We have one question from the audience. How many sessions interval should we keep and how long single session lasts?
What is the case for hair, for skin?
The audience did not specify the case, but then maybe you can give some indications.
Okay. Yes. So I always tell everybody, treatment is individualized. So you cannot cookie cutter any patient for any kind of procedure, at least in my opinion. And that's how I practice. So for, let's say, skin rejuvenation and for hair rejuvenation, one, I would tell the patient that I don't know how many sessions you will need until I see you after the second session. And then I can tell you exactly how many sessions, and I give a range. So treatment is individualized. Number two, it depends also the procedure you're going to use in order to assist the introduction of exosomes. So definitely with microneedling, you would need more sessions versus a laser procedure. And the spacing would be a little bit further for energy-based devices versus something that's microneedling. And I think most importantly is that you have a patient told me, doctor, I've come from several dermatologists and they all told me exosome application is not so good because it's for life. And so I just kind of laughed and said, think of it this way, nothing is permanent. And so I don't want to keep patients, I don't want to keep seeing them unless it's a social function. Then I tell them, it's like this, you will consider me like a dentist. In order for you to have good teeth, no bad breath, you definitely need to see your dentist at the very least once a year. So just come back and see me when you need to see me again. But as soon as I give you the result that you want, bye-bye.
Thank you, Dr. Bass. We have another question from the audience.
Sure.
Did the reaction of persistent redness occur with ExoCoBio or another exosomes? And have you seen it with ExoCoBio's exosome?
Yes. Good question. Thank you for asking that. No, it was with another exosome, and it wasn't made in Korea. Number two, have I experienced it with ExoCoBio exosome? Just once. Normally, I expect the erythema to be gone within a few hours. This one lasted for 1.5 days.
All right. Thank you. Due to the time limit, I will give you the last question.
Yes.
So this is a question from the audience.
Yes.
What was the most significant difference when you treated patient with exosome compared with these treatments without exosome, only devices?
The first thing for sure is the speed of recovery. Normally, for our Asian skin, when we used energy-based devices, usually bare minimum is 1 week. But when I use ExoCoBio exosomes, in 3 days, 4 days, it's like Jesus rose from the dead. 3 days, the patient is good to go, faces normal activity, doesn't need to cover up. The speed of response, the speed of recovery. And the second thing is that the exosomes, when you use exosomes with any procedure, the kind of positive quality, the one that you want to see, you see it within 1 session. With hair, usually in 2 to 3 sessions. And it's not me seeing it, it's the patient telling me, doctor, my hair grew. How do you know? It's only been 1 or 2 sessions. Because when he sees himself in the mirror, his scalp is no longer shiny. Or his barber said he has more hair.
Thank you. Thank you so much for your answer.
You're welcome.
Yeah. Thank you so much. Let us move on to our next speaker, Dr. Ahmad Wibowo. He's an influential aesthetic doctor from Indonesia, who will be presenting us today on how to maximize exosomes.
Okay. So today I'm gonna share about how to maximize exosome. Why? Because in my country, Indonesia, mostly the patient come to do the exosome for the skin rejuvenation. But sometimes I also got some question about the results. The doctors and the patient said, okay, doctor, I didn't really see the result, or I don't see the changes so much. So how we can manage or how we maximize the function of exosome? Because sometimes we do it in the wrong way or not in the optimum way. So we already discussed about what is exosome. So exosome is mostly in intercellular communication. So we try to activate our cell to replicate, to proliferate, or to do what the best function of its cells. So the product exosome that I use from the ExoCoBio, so we can clearly see the main function is for the cell proliferations, wound healing, anti-inflammatory, and anti-itching. So based off the microRNA. And how we manage to get maximum results. So we can see our skin. There is a stem cell in our skin, mostly located in the basal membranes, on the basal layers. But we also do have another stem cells on our skin, which is the interfollicular epidermal stem cell, sebaceous gland stem cell, melanocyte, hair follicle, and dermal stem cells. So we have 5 kinds of stem cells. But the location is on the membrane vessels deeper. And mostly in our skin, our epidermal thickness is around 100 until 400 micrometer. So how we manage all the microRNA from the exosome penetrate into our basal membrane and deeper. So this pathway is the most important things. So stem cell derived exosome penetrate into epidermis of skin samples in time-dependent manners. And the result, it increased the collagen type 1 and elastin. But it's only on the epidermal layer. So how we manage the exosome penetrate deeper? There is several devices that we can use. For example, for the first one is we can use the microneedlings. So it is just for a comparison. If we apply an ink before the micropenetration pen, and we do it the micropen first, and then we apply the ink. Of course, there is a different results. We have to apply the ink, for this case, an exosome first, and then we apply the microneedle pen to help the exosome penetrate deeper. So it's depending on how deep your microneedling is. But if we compare with the CO2 lasers, CO2 laser demonstrated ink localization within macrothermal zone without time dependent. It increased the depth. Why it increased the depth? Because there is a coagulation zones. Coagulation zones implies even greater absorption of the drug delivered across the channel. So that's why lately, mostly the doctors use the microneedle RF compared to micropen. Because of what? All the inflammatory of all of the coagulation zone increase the drug absorptions, of course. But as we know also, if we increase the heat into our skin, there is no longer a coagulation zone, but it becomes a carbonation zone. The carbonization zone is lowering the drug absorption. So how we manage between the coagulation zone and the carbonization zone? So mostly the coagulation zone only happen if we increase the heat below 60 degrees Celsius. We cannot increase the temperature of our skin more than 60 degrees Celsius, more than 6 minutes. Because after more than 6 minutes, our skin getting into a necrotic tissue, into a carbonization zone, so it's limit our skin to absorb the exosome. That's why it's the most difficult one. if we are using the microneedling RF, sometimes we cannot control the heat, the temperature that we are giving into our skins, especially when we are doing the multiple pulses. That's the problem. That's why lately, I'm using this kind of laser. We call it the thuliums or the subablative lasers. Why? Because in the thulium laser, we can adjust our pulse durations. The pulse duration, it means we can adjust how long the laser will contact with the chromophore. So we can adjust how high temperature that we will give to our skin. That's the first one. The second one, why we do give a thulium or subablative laser like erbium glass, we can give some like erbium yak or the CO2, because when we do give this, the ablative laser or the subablative laser, we make our epidermal layer slightly more thinner, so it helps the exosome penetrate easier into our basal membrane and deeper. But there is a certain problem. For example, like the non-ablative laser, the erbium glass, mostly we can see from the pathohistological pictures, the epidermal skin is quite intact. So it's not helping the exosome penetrate deeper. Compared than the subablative and the ablative like erbium yak and the CO2, because the epidermal layer is slightly broken, so it helps the exosome penetrate deeper more easier. That's why for these cases, I do prefer using the subablative and the ablative. But for the ablative, I do prefer the erbium yak compared than the CO2 lasers, because in the erbium yak, sometimes I can control the pulse durations. With the CO2 lasers, mostly the heating process becomes higher, because in the CO2 lasers, we do give higher energy compared than the erbium yak lasers. So the chance of we are creating the carbonization zone is slightly higher compared than the erbium yak. That's why for the maximum results for these cases, I do mostly use the thulium lasers and the erbium yak lasers. Sometimes I also do using the microneedling RF, yes, but in some cases we do conduct some comparison between the microneedle RF with the thulium and the erbium yak lasers. Indeed, we can see the results is much better with using the thulium laser than the erbium yak lasers. And lastly, I do try using the fractional pico lasers, fractional Nd:YAG pico laser. Why? Because using the fractional pico laser, the laser can penetrate deeper compared than the thulium and compared than the erbium yak lasers. Using the thulium, the deepest layer that I can penetrate is only on the basal membranes. Within the erbium yak is slightly more superficial. But how about the case of pigmentations? The hardest case of pigmentation, the pigment location in a deep dermal layer, that's the hardest one. So the laser that can penetrate on the deep dermal layer is only the 1064 lasers. That's why I use the Pico 1064s. So, but if I use the normal mode of the Pico lasers, the superficial layer of epidermal skin is still intact. So it's quite hard for the exosome penetrate deeper into the dermal layer. That's why I changed the Pico into the fractional one, because the fractional Pico can penetrate, we can create a tunnel into our dermal layer. So our exosome can penetrate more easier. And then the exosome also stimulate our macrophages. We do know our macrophage, we do need it, our macrophage, to eat the melanins. So most of the cases when we do only lasers on patient that already quite old and our macrophage is not that good anymore, So when we do hit the melanin with the laser, of course the melanin will gonna broken down, but there is no more macrophage to eat the pigments. So I do use exosome to stimulate our body to produce the macrophage, to activate the macrophage from the M1 type into the M2 type. What is the difference? The M2 type is an anti-inflammatory macrophage. We don't want our body to have a lot of inflammation because our body can create a PIH. Especially in my country, which is my patient have a lot of skin type of my patient is mostly type 4 and type 5 and type 6. My patient is quite easy to create a PIH. So of course I need an anti-inflammatory devices, anti-inflammatory drugs to reduce the level of PIH. But if we use steroid too much, of course the rebound effect of the PIH is gonna be more severe. That's why I use the exosomes. So mostly after I do treat using the laser like the thulium lasers, like the erbium lasers from the fractional pico lasers, I do apply the exosome to help the penetration of the exosome and to maximize the coagulation zone. That's the first one. And the second one, do not apply it too much. 1 cc until 2 cc is more than enough. Because of what? If you apply 5 cc to whole face, most of the exosome is gonna evaporate, that's all. So you don't need to apply more than 2 cc for the whole face. What you need to do is apply multiple times. For example, in my clinic, after the patient do the treatments, I do apply the exosomes. I give the exosome to the patients and tell the patient to apply it every 2 hours. So it's better to apply it multiple times in a day compared than we give all the 5 cc for the whole face in the single sessions. Because the penetrations starts slowly. Mostly the penetration gonna start from 30 minutes into 1 hour. That's why we don't have to apply it in a single sessions. But how about we apply it in the next day? In the next day, our tissue start to grow. Our tissue start to proliferate, the wound healing start to regenerate. So it's less absorptions if you apply it in the next day. So it's better to do it in the day after you doing the lasers, you doing the treatments, and then apply it multiple of times. So this is for the results for the pigmentation. For these cases, I'm using the thulium. This is the case of the pigmentations after second times of thulium lasers and the exosomes applied topically. Only 0.2 cc because this is only a small area. Apply it multiple of times. Normally in a day, I tell the patient to apply 5 times every 2 hours. And after this, this is also for the pigmentation, but also same using the thulium lasers. And this one, I'm using the fractional pico. This case is not only the pigmentation, but used to the patient have a deep melasma, and then after multiple times of lasers, the patient creating a PIH. On this case, is quite severe PIH. And the patient is quite traumatized with the laser because of the PIS after the laser. So on these cases, I'm doing the fractional pico because the pigments start from the epidermal into the deep dermal layers. So after applying the pico lasers, and I do applying the exosome also 5 times in a day. Normally I did it, these treatments normally once in every 2 months. That's the normal cases. This patient is after a year. So this cases takes multiple of times. It needs a gradual. You cannot expect patient to see the result after 1 time treatments only. And for the hair, the previous speakers already told about. I also love the result about the hair, but for the hair also, I don't like to use the micro pens. Normally, I use the thulium lasers also for the scalp because it's less downtimes also and it's not that painful. And for me, it's absorb the exosome is faster, more efficiently compared to dermapens. So this result is only shown after 2 months. And these pictures only after twice in 2 months. So I use exosome once in a month for these cases. Thank you.
Thank you so much, Dr. Ahmed. It was really helpful for all the audience. So let's move on to the Q&A session. So I have a first question for you. Aside from pigmentation, when do you usually use exosomes? In which indications, and which indication works best, in your opinion?
Okay. In my opinion, there is several hard cases like a PIH, but it's post-inflammatory erythema. So mostly the post-acne patient, they're developing a post-inflammatory erythema, and it can last quite long. So when I do applying exosome on those cases of my patients, normally the erythema will go in 2 months. In 2 times treatments, once in a month. So 2 months, almost 80% of the erythema is completely gone. That's the thing that I like about the exosome. And second one, I do like apply exosome for the hair also. Yes, that's the most cases in my clinic, beside the pigmentations.
Okay, we have another question from the audience. Exosomes play a key role in initiating regenerations. Why does applying exosomes several times per week contribute to the treatment effect?
Okay, so I never recommend to apply exosome every week because our cell to proliferate, normally our cell needs 3 to 4 weeks to proliferate. So when we do apply exosomes, it needs times to our cell to respond, our cell to proliferate before it's showing its results. So once every 3 weeks or once every month, it's sufficient enough to give the results to the patient. The key point is to tell the patient to be patient because it needs some time to show the results. And the most important thing is also our skin is getting enough dose of exosomes. That's why we have to maximize the penetration. We have to maximize the absorption rates of our skin for the exosomes.
Thank you. We have another question. So how do you encourage or explain exosome treatments to patients, given that, exosome treatments are usually quite expensive?
Okay. In Indonesia, in Jakarta, especially where my clinic location is, we do have skin type patient 5 and 6. And mostly energy-based devices also one of the most favorite treatments. But we do know if we do give energy, there is also a heat. We give heat to our skin. We give heat, it means we give an inflammation to our skin. And I don't like to give a steroid in a long period. I don't like to give a steroid cream regularly to my patient because it creates a skin atrophic and it creates telangiectasia and anything else. But if we don't give an anti-inflammatory, the response of PIH is also high because the skin type is quite high. I always tell to the patient, okay, the major problem in my clinic is the skin rejuvenations. The patient wants the skin to look more white, more brightening, more glowing. Of course, I don't want the pigments getting more. I need the anti-inflammatory and also work as a tyrosinase inhibitor. So it reduces the melanin process. So I always tell the patient, if I do combine the laser with the exosome, the response of PIH is dramatically slowing. That's the first one. The second one, it's reducing the downtime of the lasers. Mostly the patient can go out after 2 or 3 days. Normally, if we are using the fractional laser, the downtime takes a week. It reduces into 2 until 3 days. So mostly I'm going to tell the patient that it's much safer to use exosome. So mostly my patient don't complaining about it. As long as it increase the response of the lasers, reduce the downtime. So for me, it's worth it.
Thank you so much. Since we are running out of time, maybe we have to move on to our next speakers. Thank you so much, Almond, for your comprehensive lecture and your Q&A. Very helpful.
Thank you.
So last but not the least, we have Mr. Byung Cho, founder and CEO and CTO of ExoCoBio. He brings an outstanding career as both as an investor and a scientist. He will be speaking to us today on ExoSCRT Exosomes, a new paradigm in intimate rejuvenation. Welcome, Mr. Byung.
Hello everyone, I'm Byung Cho. First of all, we are really appreciative you are joining for today. My topic for today is kind of updates on our events and on our award. This year especially, I'm focusing on a new product for intimate care for vaginal rejuvenation. We just completed 3 Exosome products called Exosome Regenerative Trifecta. Here we have earlier more updates on the number of the publications from ExoCoBio. Now we have 22 scientific publications of clinical non-clinical study, and especially this year, many doctors and our veg science team are working hard to produce 7 more publications this year. And when you look at number 5 here, we are generating, or we are seeing more and more cases very quickly, which means that doctors and patients are very satisfied with the efficacy and the safety of our Exosome products. And I'd like to share this slide. We have one article from AIR. In this article, you can see that exosomes might be bigger than Botox. And when we look at the number of publications on PubMed, the publication on botulinum toxin is more than 25,000. However, on exosomes, we could see more than 31,000 publications, which means that a lot of scientists and doctors are working together to do their homework to help to improve the quality of life in the world. And lastly, because we had great sessions, and you can see that definitely many doctors loved exosome sessions. You can see here exosomes is becoming one of the most favorite sessions. And ExoCoBio is a global leader. We brought 25 speakers and 55 lectures there. And this slide is very important. So we could see about 30 exosome companies at last IMCAS. But when you look at this table announced by IMCAS Scientific Committee, actually they questioned several things to 12 exosome companies, but only 6 companies are included here because they responded to the questionnaires of the IMCAS Scientific Committee. And when we look at all the numbers in this table, it's all about scientific publication. So ExoCoBio is here, absolutely the leader in this exosome industry, and ExoCoBio is the only exosome company who has done clinical studies ever. And we are doing 4 more clinical studies. 2 of them are ongoing in the United States, and we will see more clinical studies. And about 2 weeks ago, we joined AMW Monaco. And here in this slide, I'd like to mention that our kind of new product named ExoBalm became the best cosmetics. Actually, last year, our hair product became the best cosmetics, but here, back to back, our ExoBalm product again became the best cosmetics. We are very proud of this award. And now ExoCoBio is growing very fast, and for Australia and New Zealand market, you know, InMode, one of the major players in medical device or any device industry, InMode decide to sell or distribute our product together to promote their business. So we are very happy to have this kind of collaboration with InMode, and you will see more and more major collaboration over time. So this is one of my topics for today. So we are seeing a lot of exosome products, but sometimes we call them exosome-like products. We believe that there are 5 types of exosome-like products on the market. The first one might be the conditioned media. The second is fruits or vegetable-derived vesicles, or sometimes we can see that animal cell-derived vesicles too. And sometimes manufacturers are saying that they have autologous exosomes. And then other types of companies are selling synthetic exosomes. But when we look at one by one here, conditioned media is conditioned media. It was a great technology, but it has good things and bad things. And we had to purify exosomes for better next generation regenerative aesthetics, definitely. And then mostly conditioned media is pro-inflammatory due to high number of undefined materials inside. And then sometimes you can see these kind of synthetic exosomes, but unfortunately, there is no real synthetic exosomes. It's impossible. So when you look at their product label, you can see that they are containing mostly collagens and HA and trihalose, something like that, or growth factors. So I hope you can be cautious to check the actual ingredient of their exosomes in the future. And this slide is all about the blood derived exosomes product, maybe. And then, any kind of blood, there are so many lipoproteins or other undefined nanoparticle or nanovesicle like something. But unfortunately, the size of lipoproteins here is almost similar to the size of exosomes. So when you look at on the right side, an electron microscope image, there are only 2 actual small extracellular vesicles or exosomes, while there are thousands of lipoproteins. So when they say that they have autologous or blood exosomes, actually, I believe that they are counting lipoproteins as an exosome. So maybe we can ask them to provide their electron microscope image of their exosome samples to check the reality. Because you can see that here, there are so many things in our blood or in animal blood. And at IMCAS, I found that one product named something, but the product is like this small filtration device. When I look at their brochures, they are talking about 5 nanometer pore size filter, but scientifically and theoretically, it's impossible to isolate exosomes only from this simple filtration device. So, and then they are saying that their samples co-isolation is proteins, lipoproteins, protein aggregates. So it's quite difficult to isolate exosomes from any kind of blood. And here you are seeing one example of product ingredients derived from fruits or vegetables. There is no registration. So we registered all of our exosomes or extracellular vesicles, so please be careful. Like this, and we have definitely on our product label here, for example, those stem cell exosomes or extracellular vesicles. And other manufacturers are saying that they have a fully GMP compliant large-scale production facility or process. But when we see, we have created master cell bank, but most of our competitors or other players, they don't have any master cell bank for consistent product quality. especially in this slide, you can see that our production scale is like 72 liters of conditioned media, which is almost $200,000 worth per batch. But some of them, they are using just 200 milliliter scale. And this is our TFF production device, which is 1,000 liter capacity. But some of our competitors, they are based on 30 liter. And on the left side, you are seeing that one of our big device, it's ASCEPLus actually, it's 130,000 worth and fully GMP compliant. But on the right side, you can see that other players are based on just simple filtration gadget for research use only, actually. And please be careful to choose any exosome ingredients or product. And this is I'd like to share some of our cases from our doctors. So it's another necrosis case from one of our plastic surgeons in Korea. And we are working with Dr. Paul Han in Australia. He actually treated this kind of scar by point insertion. But because he had an option, and you can see that the scar was very improved by this kind of treatment. And another scar case from Dr. Ingobelite. And one of our US doctor, Dr. Arash here, he is combining RF microneedling or through-limb laser to improve wrinkles on body. So it's another clinical application. And Dr. Ingobelite shared this keloid case. This keloid was caused by high concentration of TCA, but he was very successful to help this patient. And another doctor, Dr. Daniela Lemes from Brazil, she combined through-limb laser with our product to help this patient on the dermatitis in the back. And we are very happy. And this case from the Philippines, one of the Dr. Victoria Bello, it's about post-chemo hair restoration. And they found our product is very helpful to this kind of patient too. And Dr. Subaros is a dermatologist in Thailand. He shared this case with me. This patient didn't respond to steroid or immunosuppressant for 10 years. But when he combined fractional people cell laser with topical application with our product, the patient responded very well. And this case came from Lebanon. And here you can see that this male patient of 49 years old, he was responding. It's ongoing study now. And Dr. Sparrows published this very nice hair polyersis case 2 months ago. And I was surprised to see this case because most people thought that white hair polyersis cannot be normalized. But here's a new protocol, topical application with our product with the picosecond laser. You can see that the big difference before and after. And when we see a longer one hair, the distal part is still white, but the proximal part is black, turns black. So which means that somehow this protocol reactivated melanogenesis in hair follicles. And this is a publication. And actually, this is my topic for today. But this is great news that last AMWC Monaco, our new product for intimate rejuvenation became the best regenerative aesthetic product. We are very proud to see. And many OBGYN doctors are starting to apply our product to help their patients. So Dr. Süleyman in Turkey is one of our carriers. And again, here, regeneration and anti-inflammation together can help many patients in terms of the quality of their lives. It's almost similar to the clinical protocols on face or hair. You can use a monotherapy or you can combine with other energy-based devices. And then Dr. Juramis is using Morpheus 8 mostly. And she was a pioneer in this field to help people. For example, regenerative or repair process was done. And this is what she commented. There is still hope for lichen sclerosis and or menopausal condition by surgery. We are very happy to see this comment. And this case came from 3 years ago. It's about interactive aging. It was improved by the treatment of our prototype of our product. And on the left side, it's a Korean case combined with RF microneedling. And the doctor's comment is like the condition of 50 became 30. So we are very happy to give her more than 10 years here. And one Polish doctor shared this case on lichen sclerosis. I was told that usually it takes more than 6 months or up to 12 months to have this kind of paper. And we have many cases. This is about dyspareunia or pain. The pain was reduced from 8 to 2. The normal level is just 4 or 5. She couldn't wear pants. And Dr. Pablo from Colombia shared this case. And the last comment is like this: a complete anatomical restoration, and the patient remains symptom-free. And you can see that before and after the change, big difference we could see. And Dr. Trace Ruiz, she had gone through all the cases, and she had a lot of photos like this, lichen sclerosis, vaginal atrophy, urinary incontinence was significantly improved by the treatment of our product in combination with the needle RF, like this one. And you can see that usually they do surgery, but by this new protocol, some patients don't need surgery anymore. Hydration case. And this is no device case, just she put some IRLB inside vagina, and then she could see a very nice improvement in terms of atrophy and dyspareunia. So this is what she commented. Patients loved the convenience and the short protocol, non-surgical, minimal downtime, something like that. And we could see 2 awards to our doctors, Dr. Juramis and Ernesto, became the best genital intervention doctor this year. And Dr. Pablo, she became the best internal medicine doctor with our product. You can see. We are very happy to see that. So some of you guys, I hope to see you in September. So again, please remember these 9 questions to choose the right technology and the right product. Thank you so much.
Thank you so much, Mr. Byung. Let's move on quickly to the Q&A session. So we have questions from the audience. Why most of exosome products always adding growth factors, hyaluronic acid, and other active ingredients, not just pure exosomes?
Yeah, it's a great question. I think there are 2 reasons. The first one is I found that from my 7 years of experience, exosomes is one of the best biological materials for our bodies, but they are kind of messengers or signal transmitter. So when we apply exosomes for example, wound healing, our tissue needs amino acid for protein synthesis. So we need to create a synergistic effect with exosomes and other ingredients like amino acids. And the second is we found that it's about business maybe, but the exosomes are still very high cost, and we would like to lower the cost by adding other ingredients, but still maintaining the whole potential of exosomes. So it's like that.
Okay. So second question, we also have another question. What is the differences between SRLV, HRLV, and IRLV? Can we use a SRLV for hair or intimate area and vice versa?
Well, we try to optimize the formulation of each product. So when you look at the ingredient list, we changed some growth factors for other ingredients. So I don't recommend their product for facial skin, and they have a different concentration of exosomes and different concentration of other ingredients. So we have kind of optimized product for each area.
Thank you. Let's have last question. So there are exosome products in the market that can be stored in the room temperature. Why does ASC have to be kept in 2 to 8 degrees Celsius?
So scientists are saying that unfortunately exosomes are not very stable at room temperature because their lipid membrane breakable at high temperature, and I believe that exosomes are containing 2 or 3 important molecular groups like proteins and lipids or microRNAs. Especially microRNAs are very unstable at high temperature. Also other growth factors too. So at the beginning I thought Botox, it's a lyophilized powder, and I believe that the lyophilization is the most important way to maintain the potency, and proteins and microRNAs should be kept at lower temperature. So that's so we have other publication too to show that lyophilization and low temperature is the best way for long-term storage.
Thank you so much, Mr. Cho. Thank you so much to all the speakers today, Dr. Blas, Dr. Almond, and Mr. Cho for sharing your knowledge and expertise today. And thank you so much for everyone here today for your time. I hope you had a fruitful time to learn more about exosomes and its applications. Thank you so much.
Thank you so much.